We're seeing expansion or upgrades at two major medical facilities in Grand Rapids. A $48 million project at St. Mary's Hospital and next door at Mary Free Bed Rehabilitation Hospital. The final steel beam went into place on the shell of their $62.5 million project. 24-Hour News 8's Joe LaFurgey takes a look at the projects and the bottom line for healthcare costs in West Michigan.
This is a typical operating room at Mercy Health St. Mary's. It's only about 400 square feet. And look at all the equipment they have to cram into it, all this new technology. And depending on the surgery, you're talking more technology and more people. That should matter to you if you're on this table. Of course, you probably won't be in any condition to notice the expanded operating rooms under plans unveiled today.
Because of their situation, most of them are anesthetized when they go through this process.
But you and your family might appreciate the new pre- and post-op rooms.
The families will be able to experience a much more comfortable and relaxed setting that will allow us to communicate with them more frequently during the course of the surgeries.
Just down the street, Mary Free Bed Rehabilitation Hospital is expanding. The 122-year-old institution will more than double the number of beds.
This facility is an expansion of both programs and then also just the sheer volume of number of patients that we can take care of.
In Mary Free Bed's case, it's about expanding its reach beyond West Michigan. In Mercy Health St. Mary's case, it's about making patients and their families comfortable in a market with a lot of healthcare choices.
I don't know if I would characterize it as a battle. We certainly have some competition in place.
Which raises a question. With all the new building and expansion, are there enough patients to support the changes without driving up costs?
We started to see a big jump in that as we were building more buildings.
Grand Valley State's Seaman College of Business puts out their annual health check detailing trends and cost in West Michigan. And the 2013 edition shows some interesting trends.
Between 2005 and 2010, we saw the number of outpatient visits to hospitals in Kent County double.
And outpatient care is cheaper than inpatient care. That's just one factor helping keep costs manageable.
We're starting to see some increases in costs as we add a lot of new facilities, but we're still below what we're seeing in other cities like Milwaukee or Portland, Oregon, which would be sort of comparables to us.
They hope to complete the renovations here at Mercy Health St. Mary's by mid-2015. In Grand Rapids, Joe LaFurgey, 24-Hour News 8.